Sa nama je sljedeća dr. Karen Reed iz fondacije Dogs Trust, koja će kroz svoju prezentaciju prenijeti bar dio svog znanja i iskustva o principima i globalnim praksama humanog upravljanja populacijom pasa. Karen je doktor veterinarske medicine koja je vodila i međunarodni odjel fondacije Dogs Trust, uključujući nas u Bosni i Hercegovini, koja ima veliko iskustvo u ovoj oblasti, pa pozdravimo je jednim velikim aplauzom. Karen.
Dobar dan. It's very wonderful to be here back in Sarajevo again. I've spent many days here over the years, and it's wonderful to be back. Thank you. So, what is dog population management? I'm going to talk about the basic principles and also share some successes as we go forward. So, what is dog population management? It is a whole systems approach, and you heard just then Anita and Alida talking about the fact that it needs to be continuous, and that's a really key point that I want to stress as well. I've often had people say to me, when are you finished with the project in country X or Y? When will dog population management be finished? I see dog population management a little bit like public health. It's a continuum. We'll always have things to do. We need to set up frameworks and systems to deal with problems as they arise, or challenges for dogs and people around dogs, but it's not something that finishes. So, for example, in the United Kingdom, 150 years ago, our main problems with dogs and challenges were dog bites and rabies. And through various ways, not necessarily the best means that we would consider in the modern world, we managed to solve those problems. The problems we have in the United Kingdom now around dog populations and dogs in general and dog welfare are those around obesity or inappropriate purchasing of pets with extreme conformation, like dogs with short noses and mutilations of cropping of ears. So we have different problems, so it continues. So dog population management is something that is, in my mind, a continuum. We'll always have to work at it, but how we're working and what we need to achieve might change with time. They exist all over the world. It is a continuum. And dogs live closely with people. We know they've been domesticated for more than 15,000 years. Estimates of populations of dogs in the world, I've seen estimations of around 1 billion now, which are not necessarily exaggerations. So there's a lot we need to be doing around the world. So how have people worked on dog population management in the past? Many of you will be aware that traditionally, or historically, shall we say, people often resorted to culling. So mass killing of dogs because they felt there were too many on the streets and that was causing bites or they were causing other nuisances. Fortunately, I think that is mostly accepted globally as an outdated approach. It still happens. I think it happens less often as a formal government-sanctioned event now, although it does still happen around certain sort of sporting events, things like when Olympic Games or World Cups are being arranged, you will often find that happening, but it also still happens at a community level. We know it's largely inhumane, and we also know that it's definitely ineffective, so it's not a solution. So things moved on, and the system became very much, well, let's move dogs into shelters. That might seem as a good idea. We're not killing the dogs, we're putting them in shelters. Again, it's not a long-term solution. It's very much hiding the problem away, out of sight, out of mind. It's rarely good for the welfare of dogs. I think many of you that have worked in shelters or seen shelters, there's a really important concept of capacity to care. So if you have too many dogs than you're able to care for, which is very, very common, and understandably people want to keep bringing dogs in, you will end up not being able to maintain or support the welfare of those dogs. So it's really important that we see sheltering for what it is. It still has a role, and we'll talk about that a little bit later, but it is not a solution per se to having too many dogs on the streets. And also consider, for those dogs in a shelter anyway, if you consider the 5 welfare needs or the 5 domains, are they really satisfying for a dog in a shelter? Even with the best shelters in the world, and we have in the UK, in Dogs Trust, we have, I would say, some of the best, what we call rehoming centres in the world. They're still kennels for dogs, and that's never the best thing for a dog, I think, as we know. So we move forward on from sheltering, removal to shelters, to CNVR, catch, neuter, vaccinate, return. We're all aware of that, I'm sure. We've all been involved in that, as I have. And it seems like the perfect solution. There's too many dogs on the streets. It's new to the dogs. That will reduce the population. But when we started to do that, we often find it's not actually achieving what we thought. The dog population is remaining the same, or it's even increasing. So I think we've moved on a little bit from understanding that that CNVR, which is generally focused on those free-roaming dogs that we can see on the streets, who may be owned by a community. There are very few truly feral populations in the world that have no human contact. But it wasn't really working. It's because we weren't really looking at the source of those dogs. So why are there those dogs on the streets? Where are they coming from? Are they puppies being born on the streets? Are they puppies being abandoned? So we needed to move towards something that was more holistic, more in-depth in terms of looking at the causes. So we moved on to what we call dog population management. So just to reiterate, we're needing dog population management for dog welfare, but also for that human health dynamic. As we've talked about, there's a very strong bond between human and dogs around the world, and it's really important that we keep that traction maintained so that we do actually move things forward both for dogs and for humans. When we're thinking about setting up a dog population management system, it's really important to look at what are we actually wanting to achieve? What right now does the community that we're working with, or the government of a country or of a region or of a part of a country, what are we actually trying to do? Are we trying to reduce a risk of a disease such as rabies? We're trying to just reduce dog bites? Are we looking at some environmental issues? People are talking about dog feces on the streets, the noise of dogs, that sort of thing. Are we looking at attacks on wildlife or livestock? Or are we looking at the numbers of dog on the street as our prime problem? And do we want to remove all those dogs? Do we want to reduce the population? Do we want to stabilise the population? It's really important to know right at the start what we're actually wanting to achieve. And looking at these principles around dog population management, and these I've sort of adapted from those that you'll find on the ICAM website, which is a really useful resource. So principles of course, humane. We're here for dogs and humans. We want to do whatever's right for the dogs and people, but it needs to be a humane solution. It absolutely needs to be adaptable and relevant to the context in which you're working. So the excellent example that we've just talked about in Bosnia and Herzegovina, and particularly focused around Sarajevo initially, what we were doing in Sarajevo was not necessarily something that would work in the rural parts of Bosnia and Herzegovina. It certainly might not be something that would work in Bangkok in Thailand or in another part of the world. You have to consider what resources you have, what the challenges are that you have, where you are already with community engagement and government policy. Not only does it have to adapt to context, it also has to flex with time. And as you've seen with what we've done in Sarajevo, or in Bosnia and Herzegovina, what we started off with 12 years, we've still got things to do, but they're slightly different. What we were working on in the United Kingdom even 20 years ago, in Dogs Trust in the UK, our challenges now with our rehoming centres and our rehoming and prevention work in Dogs Trust UK is different than what it was 20 years ago. We've had COVID, we've had cost of living crisis. So things have to be able to flex with time as well. And we need to have information, we need to have data, and you're going to hear a lot more about that later on through other presentations. So I'm not going to go into the detail here, but you absolutely need to know at least a fair bit about what's the current challenge with the dogs on the streets. And this is the infographic here is again taken from ICAM. It shows a little bit about the dynamics of dogs, which is really important. As we've mentioned before, you need to know these dogs on the street. Are they truly feral? Probably unlikely. Are they fed by people? Are they owned by people and let out during the day? You do need to understand that dynamic. That's really key. You need to have some understanding of baseline data. You don't necessarily need to have an absolute figure of the population of dogs on the streets, although that can be useful, and again you'll hear more later. But you need to know something so that you can also continue to monitor that and see how you're doing progressing. So understanding that baseline allows that ongoing monitoring and evaluation. And as I mentioned a little bit earlier, it's very easy to focus on effectively the symptom, what you're seeing. You're seeing too many dogs on the streets, people are complaining about dog bites, that's the problem. But you do need to understand and try then to address the root cause. Why is that happening? Because if you don't address the root cause, you will just keep doing the same thing without seeing a huge amount of change. And when we're talking about root causes, in most cases we are talking about wanting at the end of the day some people to change their behaviour. That might be general population of dog owners, it might be people that don't like dogs, it might be vets and technicians, it might be government policy makers. So we'll need some degree of human behaviour change. That's what we're trying to do. And I just put this slide in here because it can be very easy, because we talk about dog population management. So we're thinking about things very much at a population level. But for me, as someone working in animal welfare, as many of you, most of you will be as well, that balance is also important to make sure we're not neglecting those individual dog welfare issues. So it can be very easy to think quite utilitarian about it, in terms of we can make the best difference for as many dogs as possible, but we also have to respect the welfare of those individual dogs. And slightly going back to the data point as well, when we're thinking about what's our problem that we're wanting to solve, what's our objective, again, right at the very start, we need to think, how are we going to measure whether we're making a difference or not? So these are just some examples of, if you're looking at making difference to animal welfare, what are the things that you might be able to measure that will show you that in 5 years' time or 10 years' time that you've actually made a significant difference? So just to move on a little bit to the various components of dog population management, there's all sorts of interventions and activities that might form part of this. So I've generally, the areas on the left that are sort of a bit more grey in colour, those are the areas that, in my opinion, are generally needed most times when you're looking at dog population management. It will depend on your context, as I've said, right now and in the future that you might need as well. So we'll definitely need to be having people very motivated to do their work, whether those are the veterinary services that you're using, whether those are dog catchers, whether those are people working in shelters. They will need to be motivated and trained. We know that. We know that we're going to need access to veterinary care for those dogs as well. So it might not just be around neutering, but we want these dogs that might be free roaming to have access to quality and affordable, if necessary, veterinary care. So we do need the vets involved on that and to be trained and motivated. We're definitely probably going to be doing some neutering. Now that may well be the catch, neuter, vaccinate, return, so picking up dogs from the streets that are apparently unowned, neutering those, vaccinating them probably against rabies and potentially other diseases, and then putting them back where they came from on those streets. But we also, this is one I think gets missed quite a lot and is a challenge, and we've done a lot of that here in Bosnia and Herzegovina with Dogs Trust Foundation, is neutering of owned dogs. Because in many cases, not everywhere, you'd need to know your own context, those dogs on the streets are possibly owned dogs that are causing the increase in puppies. So how do we get owners to neuter their dogs? How do we allow that to happen in an affordable way? Of course, we need to look at responsible ownership and what that means, and that would be different. Sometimes we might need to look at some of those on the right-hand side. Once you get a little bit further down the line, or even earlier stages, and I know there's been some good work happening in Bosnia and Herzegovina around this, but you might want to look at identification, sort of obligatory, mandatory microchipping, for example, and a database that everybody can access, a registration that works really well. I've put rehoming centres and traditional shelters on the green side, on the right-hand side, because it tends to be the one that everybody leaps to first. And for me, it's not the first thing we should be thinking of. It may well play a role for temporary sheltering, for transitional sheltering, moving dogs from the streets to where they are adoptable to a new home, but we mustn't really think of it as the sole solution. And similarly with education of children, we have done some brilliant work here, I think, in Bosnia and Herzegovina with working through generations of children with their education programme. Education programmes are very difficult to measure the impact of in terms of long-term behaviour change. We can measure, did children take on the information? Are they able to recite what they've learnt? Do we feel like they've got some motivation to make changes in terms of just being safe around dogs, for example? But how do we measure that long term? So it's not something to be undertaken lightly. And I've yellowed out here the service providers, government legislation and engaged communities, because these are the three stakeholder groups that we need to engage. We may not need them all now, but we need to consider them all. So we need to consider those, what I call service providers, vets, veterinary technicians, shelter staff, dog catchers. There might be others, groomers, might even be things like insurance providers. It can get quite wide. When we're talking about community, we're talking about dog owners, but carers and feeders in the wider community. And we mustn't forget, we must not neglect the sort of government enforcement and implementers and developers of legislation. We may not need them all the time, but you certainly need to consider all those three groups when you're designing a programme. So with service providers, for example, who are you going to use? Do you have a very strong government veterinary service provision that you could use? Is there a strong private sector? Are there lots of NGOs that employ vets? Who are you going to be working with? And consider how you need to engage with them. And it's not just about training for surgery, but it might be more wider training on good contextual care, private medicine for dogs. What we're really looking for at the end of the day is an accessible, available, acceptable, affordable and quality service provider for dogs. And they might be a mixture of government, private and NGOs as well. I think it's also important to not forget the other providers. So, you know we will all have shelters and we will all have very dedicated people working within shelters, and we must not forget the stresses and things that they come under every day with all the decisions that we have to make around dogs in their care. So we need to work with them and make sure that they are supported and cared for and also trained in doing their job well. And similarly, dog catchers, any of you involved in that will know that this is quite a skill. And to see good dog catchers in action is quite an impressive thing to do. But it is a skill that people need to learn. And often it's something that's rather neglected, and it's almost, in some countries, I think not necessarily in this region, but in some countries it's considered quite a low skilled job. Actually, it's a very highly skilled job. So communities, I think responsible ownership, as we all talk about this, and I think we're just starting now in the UK, in the United Kingdom, to talk about what does that mean? We all talk about it as though we all know what it means, but actually, does it just mean picking up dog poo in the street? Does it mean making sure your dog gets vaccinated at the right time every year? What does it mean? So we really need to define that in the local context as well. What do we in the Balkans, what do we in Sarajevo, and what do we in Bosnia and Herzegovina want our dog owners to be doing? And it's not just those classic pet owners that have a dog that lives in the house and then they take out for a walk on a lead. It's also about where there are free-roaming dogs, and there might well be carers and feeders that feed those dogs. They're also very important. They have an ownership role of some description, even if not formal or legal. And I think it's really important when we're designing anything like this that we don't just consider people who love dogs. We also consider those who don't. And that might be for good reason. They may have been bitten by dogs in the past. They may come from a culture where dog ownership and dogs are not really part of that much close of a household. So we don't necessarily bring them in and try and make them love dogs, but we need to absolutely bring them into conversations and community group meetings to respect their point of view. Otherwise, you've got a whole sector of community that you're just ignoring. So I think, when we're talking about communities, and you'll hear, again, far better people than me talking about this later on in the conference. But for me, if you're working with a community and you're wanting to change behaviour in a community, you're looking at, for example, why people do not neuter their dogs that they own. And you'll need to understand why is that? What are the barriers? Do people feel it's not culturally right to neuter their dog? Do they feel it's too expensive? It's taking away the dog's right to breed. There aren't any vets nearby. Maybe they think vets only know about livestock. Or they'll do it later, or they think females should have a litter first. So what are the barriers that you need to address, and that you need to find the opposite? You need to find the motivating factors that will allow people to make those changes. And absolutely, we mustn't forget government in its widest sense. We must not, it's been very common over the decades, I would say, that NGOs who start off with the best intentions and really want to do things, and they struggle to get things moving forward because government is not interested, is not engaging, doesn't have the budget, they have too many other priorities. We absolutely can't do this on our own. And I know it's hard, and I know it can be a challenge, but being an NGO, being a small charity that is seen as annoying to government is not going to help you move things forward. So it might be slow, but actually making sure that you do work with your local government, any of your local legislators, or even at national level, who are the implementers. It might be police who have a role in enforcing some of dog welfare acts, for example. And obviously we've got the wider multinational aspects with things like the World Organization for Animal Health. All of our governments here will be pretty much members of WOA, World Organization for Animal Health. They will all have signed up to the welfare chapters, so they all have some degree of commitment to make these changes. We all know governments have so many other priorities, and this doesn't always seem very important to them. So it's really key that we keep those channels open and we build those relationships going forward, because at the end of the day we also need budget, and we need funding for these projects, and we do need to get some of that, at least support in kind or whatever. Might start small, but we need that to be a bit like public health. It is part of public health in a way, and it needs to be part of government priority. So I'm just going to talk just for a few minutes about a few successes. I'm not going to mention Sarajevo because that's been covered very well by Anita and Alida, and you'll hear far more if you talk to any of our colleagues from Dogs Trust Foundation Bosnia over the next 2 days. I picked a case study, and this was from the ICAM website, so apologies for my Croatian colleagues here because it's probably slightly out-of-date information, but I thought it was really interesting to share. So in Zagreb, there was a case study that back in 2001, there was the first bylaw regulating shelters, rehoming centres and holding facilities. And it was a really good example of a proactive municipality that recognised the importance of building and developing a system. And the results were quite impressive for a city that previously had operated a catch and kill policy. So I think that's one that's worth looking up, because it obviously is local to your region, and I'm sure we've got Croatian colleagues here. I think we're hearing from some later, so we might hear some more updated information. And apologies if this is a little bit out of date, but I wanted to try and choose a local regional example that was not just Sarajevo, because we're hearing about that. But it did absolutely, it proved massive improvements in management of cats and dogs in the city. It was a really good example. So I think try and talk to colleagues here about how that's worked as well. So a couple more examples that are more wider than this region. So since 2016, Dogs Trust has been working in Greater Bangkok with an organisation called Soy Dog. And the aim of that, it was a very specific aim, was to sterilise 80% of the roaming dog population, and with various objectives of reducing the dog density, rabies cases, which is still a challenge in that part of the world, and reducing human-dog conflict and improving dog welfare and creating an environment for that harmonious coexistence. They had very specific measures within that. So since 2016, that project has, I was just updating the figures last night from Adam, that project has now sterilised and vaccinated over 500,000 dogs, so over 500,000 dogs. That's a lot of mobile teams doing it, a lot of work, a lot of effort, a lot of building relationships with local municipalities, governments and communities. And so that's the output, if you like. So 500,000 dogs neutered, brilliant. But what's the impact of what I always call the and so what question? So the most recent dog population survey that we did there showed that we have nearly got there. We've got 75, just about 75% sterilisation coverage. We're getting towards the 80%. The dog density has reduced. There was 0 lactating females recorded in the 2024 survey, so that's an indication that you're getting on top of that reproductive amount. There were visible signs of improvement, so the percentage of dogs with a very low body condition of 1 or 2, so back in 2016 was 27%, so a quarter of the dogs had very low body condition score in 2016, and in 2024 that was just 4%. So it's, again, a massive improvement. And then finally, my example in India, and again, I'm sure we'll hear more about this tomorrow, but Goa in India is a state in India that was declared a rabies-controlled area. So there's been groundbreaking progress in Goa, demonstrating that that was a specific rabies project. Okay, so the objective there was to have no human deaths from rabies and to really pretty much eliminate the disease in dogs as well in terms of active disease. So we can stop people dying from that disease through mass dog vaccination. So Goa was declared a rabies-controlled area in 2021, and that's very much due to lots of people working together, but particularly by sister charity of Dogs Trust, WVS. Again, you'll hear more about that tomorrow. So the government announced that rabies had successfully been eliminated from most parts of the state, and this was a landmark achievement, and it sets a precedent for other states to follow. So there are loads of examples out there, and we can certainly point people to those. It isn't a matter of saying what did Thailand do? We can do that in, you know, Bangkok too, because it's a different context. So you really do have to look at, but there are some great examples out there. So I just want to say thank you for listening. I have got an extra slide of a couple of resources, which I think we're probably going to share the presentations at some point. So there'll be
We will share the presentation, but Karen je otvorena i za neka pitanja. So Karen will be open for some questions. I will give her her headset. Okay. Ako imate neko pitanje vezano za ovu temu, ako ne, evo ja mogu početi da pitamo Karen. Koji element sistema za upravljanje populacijom pasa najčešće je nedovoljno finansiran, a ključan je za uspjeh? Evo, to je moj početak, a vi razmislite imate li još pitanja.
Thanks, Sanja. It's a very good question. What is insufficiently financed? All of it. I think I would say it is a challenge if you are doing a CNVR program, because those are not owned dogs, well, they might be owned dogs, but they're very loosely owned. So it's difficult to really have an owner to contribute to some of that, and sometimes obviously carers and feeders are doing a lot of that, feeding and putting in their own resources themselves. And surgical neutering, as we know, is quite lengthy. It requires skilled veterinary teams, veterinary surgeons and veterinary technicians, and that is an expensive piece of it. So if we are doing a serious piece of CNVR, that does take quite a lot of money at the moment. I mean, it would be, I think our goal in the long term, wouldn't it be lovely to have a safe, humane, effective, long-term, reversible, potentially, oral or injectable neutering solution for dogs? That would make a huge difference to the world, but that's not here yet.
To znači da je CNVR nedovoljno financiran, trebalo bi povećati ili treba možda, samo da razjasnimo, CNVR je nedovoljno finansiran, a ključan.
Yes, I would say it's insufficiently funded. However, if we're focusing on CNVR and we're neglecting the neutering of owned dogs, the neutering of owned dogs might be something that can be done cheaper or with co-funding from owners as well, and that actually might reduce the need to actually do CNVR.
Okay, thank you, Karen. Imamo li još neko pitanje iz publike? Da li ima neko za Karen? Čini se da za sada nema. Resurse koje je Karen spomenula bit će na oficijalnoj web stranici ove konferencije i moći ćete je pogledati. A ja vas sad pozivam na kratku pauzu za kafu. Da, molim vas. Pošto svakako malo kasnimo, pauza bi trebala biti gotova do 11. Pa vas molim da minutu, dvije prije 11 budete na svojim mjestima, a imamo dovoljno vremena za osvježenje.